Good day, ma. My name is Olapse Nelson. Matric number 24110307. Today, I'll be presenting on electronic health record, commonly known as EHRs. My presentation will focus on what EHR are, their advantages, the challenges associated with their implementation, and the resources needed for successful implementation in the Ondo State health management. Introduction. Healthcare is becoming increasingly dependent on technology. One important tool is the electronic health record (EHR), which helps healthcare workers manage patient information more effectively. The introduction of EHR has helped address many of these issues by providing a digital way of storing and managing information. What is an EHR? An EHR is an electronic health record. It contains important health information such as patient's medical history, diagnosis, medications, allergies, laboratory test results, and treatment plan. Unlike paper record, EHR can be accessed electronically by authorized healthcare professionals. This makes it easier for doctors, nurses, and pharmacists to obtain accurate information whenever it is needed. The main goal of EHR is to improve healthcare delivery by ensuring that patient information is available, accurate, and easy to access. Why is EHR important? EHR are important because they improve the way healthcare information is managed. Healthcare providers often need access to a patient's complete medical history before making decision about treatment. With EHRs, this information can be retrieved quickly. EHR also supports communication between different healthcare facilities and professionals. For example, if a patient is referred from one hospital to another, the patient record can be shared electronically. Now, advantage of EHRs. There are several advantages of EHRs. First, they allow faster access to patient information. Healthcare workers do not have to search through piles of paper files. Second, EHRs improve patient safety because information is clearer and easier to read. Thirdly, they help improve the quality of care by providing healthcare professionals with accurate and up-to-date information. Finally, EHR make it easier to track patient history over time, which supports better treatment. More benefit of EHR is, in addition to the previous slide, EHR offers several other benefits. They improve coordination between hospital, clinic, laboratories, and pharmacy. Researchers can use electronic data to conduct studies and generate evidence for public health planning. Furthermore, multiple authorized health workers can access the same patient records simultaneously, which improve efficiency and teamwork. Now, challenges of the EHR implementation. Despite their many benefits, implementing EHR system comes with challenges. One major challenge is cost. Purchasing softwares, hardware, and by maintaining the system can be expensive. Another challenge is inadequate infrastructure, especially in areas where healthcare facilities lack sufficient computers and internet access. Poor network connectivity can also affect the performance of EHR system. In developing countries like Nigeria, financial constraints often slows down the adoption of health information technology. Additional challenges. Another challenge is resistance to change among healthcare workers. Some staff members may prefer traditional paper records because they are used to them. Training is therefore necessary to help users understand and effectively use the system. Privacy and security are also important concerns because patients' information must be protected from unauthorized access. There may also be interoperability problems, meaning that different healthcare systems may not communicate effectively with one another. Now, resources needed. First is the human resources. For successful implementation of EHR, several human resources are required. Healthcare professionals such as doctors, nurses, and pharmacists must be trained to use the system. Health informatics specialists are needed to help manage health information and ensure data quality. Information technology personnel are required to install, maintain, and troubleshoot the system. In addition, trainers and technical support staff are important to assist users and ensure smooth operation. Another resources needed is the infrastructure. Besides human resources, adequate infrastructure is essential. Healthcare facilities need computer, servers, and EHR system. Reliable electricity supply is necessary because electronic systems depend on power to function. Internet connection is also important for communication and data sharing. Data backup systems should be available to prevent the loss of important patient information in case of technical failure. Now, recommendation for Ondo State. To successfully implement EHRs in Ondo State, several measures should be considered. First, the government should begin with pilot jets in selected hospitals before expanding to other facilities. Adequate funding should be provided for infrastructures, software, and maintenance. Healthcare workers should receive regular training. Strong policies should be established to protect patient privacy and ensure data security. Finally, collaboration between health worker professionals, IT experts, and government agencies is necessary for long-term success. In conclusion, electronic health records are an important component of modern healthcare systems. They improve healthcare quality, patient safety, efficiency, and communication among healthcare providers. Although challenges such as cost, infrastructure limitations, and staff resistance exist, these challenges can be overcome through proper training, funding, and training. For Ondo State, the successful implementation of EHR has the potential to significantly strengthen healthcare delivery and improve health outcomes for the population. Thank you for listening.